Hey folks, Doug Blake with Body Design University. In this video, I'm going to bring you into Chapter 10, the muscular training, the assessments associated with muscular training. This is going to be the postural deviations. And page 398 starts the first of the 5 postural deviations. You need to know these from a testing perspective for sure. Let me just go ahead and pull this up for you. Again, page 398, Chapter 10. Now you're going to notice that they're going to give you 5 deviations. So deviation 1 is the sub-talar pronation supination deviation. This is the one I'm going to talk to you about today. Then there's hip abduction, and just so you see it, let me go ahead and show you real quick. The third one is going to be pelvic tilting. Number 4 is shoulder position and thoracic spine. Number 5 is head position. So we do videos on each one of those, but this is going to be the first one. So if you look up here, the deviation number 1, subtalar pronation supination. Now, let me get out of here and give you a brief intro real quick. I get questions on this one more than any of the others. And the reason is because you're dealing with a part of the body. When you're talking about the ankle and the foot, there's a whole lot that's going on. ACE does not really give you a picture of what they're talking about, the subtalar joint, the talus, the calcaneus bone. So I'm going to show you a quick picture here just to give you a little bit of introduction as to what they're really talking about. So let me go ahead and pull up this picture. I just grabbed a shot, booyah, from the internet just to give you an idea. Look, you can Google this and check this out, but I didn't want to give you any of the names or the names of the bones necessarily, because for the purpose of this video, I don't want you to get confused with information and material that you don't need to know. Because at the end of the day, what I want you to be able to do is to know deviation number 1 enough to pass or to answer properly on the questions that you'll be asked on the exam. So let me just give you a real brief overview of the ankle. Now, if you'll notice, you can see that this bone that I'm pointing to you here and this other bone, those are the 2 bones of your lower leg, right? The tibia and the fibula. Okay, so those are the 2 bones of the lower leg, right? And so your calf muscle would be up here, right? And your other muscles in the anterior compartment would be over here. But the point is that at the end of the day, you want to know what see the little green area right in here, okay? This is what is known as the subtalar or talar joint, subtalar joint. Okay, real quick, just from a real quick anatomy, this bone right here, see this guy right here, this is your calcaneus bone. By the way, just as sort of an aside, because it's interesting, look at all of the joints and the bones. I'm pretty sure this is one of the reasons why ACE doesn't want to get into this a whole lot with you, because from a purely anatomical perspective, there is a lot of stuff going on in your foot. This is the joint in question, the subtalar joint. Okay, this bone right here, if you can see me, I'm kind of outlining this bone right here. See this? All the way through here, all the way up here. This is known as the talus or the talus, depending on who you're talking to. So I say talus. So the subtalar, below, the joint below the talus bone, the subtalar joint is the joint that moves. And there's a little bit of movement that occurs between the talus and the calcaneus. Hope that makes sense. That's just a little bit of introduction to this postural deviation. Again, one of the reasons why ACE or any personal training certification is just not going to go so in depth in this is because for the most part, you ain't doing a whole lot with your clients when it comes to the ankle and the foot. Go to a doctor because they're the only ones that can really deal with these issues related to the foot. Again, what I just showed you there is really, really complicated, very complex. So I want to just make sure you understand that when you're talking about deviations, right, these postural deviations, particularly this first one, You just got to memorize and understand what the terms are. And I'm going to show you the one little table that is critical. But I wanted to give you a little introduction because it is helpful. Now, yes, it is a sneaker. And what am I going to show you with the sneaker? I'm going to show you just a couple of basic movements that occur at the ankle. Now, the postural distortion itself is what's known as supination and pronation. But there's a couple of other things that occur at the ankle that I think is important that you do know. Let me move this out of the way a little bit. And I'm using a white sneaker, so it's easy to see. At the ankle, right? So here's the, let me do this. So that's your lower leg, right? And then your ankle joint is sitting inside your sneaker. But a couple of movements that occur that are important to know when you talk about the postural deviation is what's known as pronation and supination. This is very difficult to see or show with a client that's wearing sneakers, right? What we normally see are inversion and eversion. So listen to those two terms: supination, pronation, inversion, eversion. The reason why it's complicated is because of those bones that I just showed you. Movement of the subtalar joint, occurs as not a whole lot of movement, but when you do have movement associated with that particular joint, it creates what's known as supination and pronation. You're really not going to see supination and pronation when somebody's wearing their sneakers. What you will see, though, is one of the effects of supination and pronation, which is inversion and eversion of the foot. Inversion is when the bottom part of the foot, right, moves inward, right? So 2 feet doing this, right? So inversion is when the medial aspect, right, of the foot, or it's easy to just say the bottom, but the medial aspect goes up, right? Or the bottom of the foot turns in. Eversion is the exact opposite. That would be when the bottom of the foot turns out away from the other foot, right? So this is the left and right foot over here. Whoop, eversion, inversion, okay? Inversion and eversion are generally being caused by, it's a couple of things that are causing it, but what ACE wants you to keep in mind is that supination and pronation, right, in the subtalar joint is why you're seeing inversion or eversion. Now there's also external rotation, internal rotation, lots of things happening there. I don't want to get into that in this video. What I want to help you to do is to understand that one component. So I just did this for you. I showed you the picture. You see the foot position, things that are happening related to what's called supination and pronation at the subtalar joint. So let's go ahead and bring that up again. Now it should be a little bit easier to understand what they are talking about. And I say easier, hopefully it's easier. And it's really in the apply what you know section. And more importantly, at the very bottom here, table 10.5. So what I want you to do is when you're studying this is read this paragraph. And if you can understand it, congratulations. Both feet should face forward in parallel or with a slight outward turning of the toes like this. Okay, external rotation at the ankle. In other words, toes pointing outward from the midline as the ankle joint lies in an oblique plane with the medial malleolus. That's that bone, that ankle. You know that when you're like when you got your bare feet, you'll notice that there are these two ankle bones, right? The one on the inside, right would literally be right here. And then there's another sort of bony protrusion. Those are the malleoli. So the medial malleoli would be the ankle bone, that part, that protrusion on the inside, and the lateral malleoli would be that bony protrusion on the outside. That's all they're saying here. Okay. So medial malleolus slightly anterior to the lateral. So the inside malleoli would be, it would be anterior or forward a little bit more. I hope that makes sense. The toes should be aligned in the same direction as the feet, and any excessive pronation, arch flattening, or supination, high arches at the subtalar joint should be noted. And I know what you're saying. What the heck does that mean? Well, that's why you're looking at the apply what you know box right here. Okay, and you can read through this. Ultimately, like I said, what I want you to do is to go down here to table 5, table 10.5. So, and this is where, from a memorization perspective, from a testing perspective, this is what you need to know, folks. This is really all very interesting information. It really is. But one thing I don't want you to do is get confused about all of these terms. And I've had students ask me, well, what's the difference? I don't understand the difference between pronation and supination and inversion and eversion. And the answer is that pronation and supination is generally movements associated at the subtalar joint. But remember, you have other joints in the foot. Okay. And what subtalar pronation and supination do is they cause the entire foot movement to be inverted or everted. And let me go ahead and explain that to you right here. So table 10.5, subtalar joint pronation, supination, and the effect on the feet, tibia, and femur. Okay. Number one, pronation at the subtalar joint. Pronation causes, or what we see in the subtalar joint, when we see pronation at the subtalar joint, we see this flattening of the arch and movement. Can you see this? Movement of the outside of the foot outward. That's called eversion. Okay. So again, pronation at the subtalar joint produces this foot movement. This minor motion or movement in this joint that I showed you. Remember, I showed you that pronation in that joint produces a more, what you can use the term gross motor movement. So this slight flattening of the arch. Remember, you can flatten your arch without lifting the outside of your foot. But this flattening of the arch movement, or what we call pronation at the subtalar joint, will ultimately lead to watch. So as my arch flattens, watch the outside of my foot. It will eventually do this. Hope that makes sense. If my arch is increased because of the subtalar movement, because of the movement at the subtalar joint, it will now create a gross motor movement of the foot called inversion. Hope that makes sense. Okay. With eversion and inversion, and by the way, when I said inversion, that's supination at the subtalar joint. Kind of got to go through this one step at a time. Movement at the subtalar joint from a supination perspective causes this gross movement at the foot known as inversion, ultimately causes inversion. Now, here's what also ends up happening. This is why we talk about the kinetic chain. Right? Literally from the foot, because of the subtalar pronation, supination, causes inversion, eversion, this gross motor movement at the foot. Guess what happens at the knee? Internal and external rotation of the knee, because everything is connected, right? So up at the knee, watch this, when you have inversion, it causes the tibia fibula complex, right? Those two bones to compensate and move either this way or this way. And basically, that's what you're seeing here in these pictures. So figure 10.5, foot pronation, supination, and the effects up the kinetic chain. Now, I will say this. They should have said subtalar joint pronation, supination. If I was going to give a little bit of constructive feedback to the editor when you do this next time in your 7th edition, you're using pronation and supination with the terms subtalar joint. So you may want to say subtalar joint movements of pronation instead of saying foot. That would be, and this is why some people get confused, I would have said subtalar pronation, supination, and the effects up the kinetic chain. Obviously, now you can see that if the subtalar joint goes through pronation, right? The flattening of the arch is pronation at the subtalar joint. Flattening of the arch ultimately leads to this gross motor movement this way, right? Eversion. That's going to, with internal, it's saying internal rotation of the knee. Why? Because as soon as I do this and I get a little bit of this external rotation of the foot, you guys can see this, right? So flattening of the arch, eversion, a little bit of external rotation at the foot. What does it do? Well, it causes the tibia fibula complex to compensate and rotate. And when it does this rotation, right, when the lower leg complex rotates, well, you're going to have a generally sort of a counter or compensatory rotation of the femur, yada, yada. So you can see this. This is why I want you to memorize table 10.5. Pronation at the subtalar joint causes eversion of the foot, which causes internal rotation at the knee. Femoral movement is internal rotation. If you're looking at somebody from the front, right? So anterior view, you're going to see this movement pattern. It's the exact opposite. And that's what you're seeing here in these pictures, the exact opposite. This is what I want you to memorize. Supination causes inversion, which causes external rotation at the knee. External rotation at the knee causes the this femoral movement known as external rotation. Hope that makes sense. Just replay the video. Let's go over this again. Subtalar joint, deviation number 1, subtalar pronation, supination. Okay, you get it? Remember, this is supination, pronation at the ankle. Okay, again, not the foot. Technically, pronation, supination is not the foot. Inversion and eversion is the gross movement of the foot. Supination, pronation occurs at that subtalar joint. Okay. Pronation of the subtalar joint causes eversion or the gross motor movement of the foot. Okay. When you get this eversion occurring and the flattening of the arch, all of this stuff simultaneously causes the tibia fibula complex, right? The lower leg complex, right? Those two bones, it causes them to compensate and rotate, and that causes this compensatory rotation at the knee joint, right? Because those two guys, right, the tibia fibula complex, actually it's the tibia, okay, causes the femur, right? Because the femur is structurally connected to the tibia, and when there's rotation this way, there is compensatory rotation, and that's why we get those common distortion patterns occurring. I will say this, it also then hits the hip, and that's why the second deviation is going to be the hip issue. But stick with deviation number 1, probably a little bit more information than you needed, because what am I telling you to do is you memorize, but it helps to understand why. That's why we'll go over this, is that if you memorize that table 10.5, you understand what causes what. There's always some compensation up the kinetic chain, and that's really what's happening. So deviation number 1, if you understand it, really understand it from the subtalar joint all the way up to the femur bone itself, you will then understand deviation number 2, and it should make a little bit more sense. Look, as always, if you've got comments, please go ahead and let us know if you understood this. By the way, if you did understand what I just explained to you in this video, write the word understood in the comment section. If you want more information on our ACE exam study, much more information, obviously, chapter reviews, things like that, audiobook, quizzes, practice exams, connection, and the ability to ask me questions throughout the entire exam study, then go ahead and click on the link below. As always, have a great weekend, and we'll see you next week. Thanks.